All India Radio presents Morning News. Good morning, I'm Abhishek Mukhopadhyay and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi says government is continuously engaged in maintaining the supply of COVID vaccine, highlights the need to avoid wastage of vaccine by states. Prime Minister to interact with doctors, paramedical staff and other frontline health workers of Varanasi this morning. India achieves new landmark as cumulative COVID-19 vaccine doses administered cross 19 crores. National COVID recovery rate improves to 86.74%. Due date of furnishing of income tax return for the assessment year 2021-22 for individuals extended by 2 months from 31st July to 30th September. First session of the 15th Assam Assembly begins today. US President Joe Biden signs anti-hate crime legislation to address rise in violent attacks against Asian Americans and Pacific Islanders. Ceasefire comes into force in Gaza Strip, bringing a halt to the fiercest fighting between Israel and Hamas. And in cricket, former Indian skipper Rahul Dravid to coach Indian limited overs team that will play against Sri Lanka in July. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard, take all precautions, and all those above 44 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi highlighted the need to avoid wastage of COVID vaccine, as wastage of a single dose of vaccine means not being able to provide the necessary protective cover to one life. The Prime Minister interacted with the district officials of 10 states on the COVID-19 situation yesterday. He said the government is continuously engaged in maintaining the supply of vaccines.
टीकाकरण की रणनीति में भी हर स्तर पर राज्यों और अनेक स्टेक होल्डर से मिलने वाले सुझावों को शामिल करके आगे बढ़ाया जा रहा है। इसी क्रम में स्वास्थ्य मंत्रालय की तरफ से 15 दिन के टीकों की उपलब्धता की जानकारी राज्यों को दी जा रही। वैक्सीन सप्लाई टाइमलाइन की स्पष्टता होने से टीकाकरण से जुड़े मैनेजमेंट में आप सभी को और आसानी होने वाली है। मुझे विश्वास है कि हर जिले और वैक्सीनेशन सेंटर के स्तर पर सप्लाई और सुदृढ़ होगी। इससे टीकाकरण से जुड़ी अनिश्चितताओं को दूर करने में, पूरी प्रक्रिया को स्ट्रीमलाइन करने में बहुत मदद मिलेगी।
The Prime Minister also stressed on constant innovation and adoption of dynamic methods and strategies to effectively deal with the challenges posed by the COVID-19 pandemic. He said the virus is continuously changing its form and the scientists are working to deal with the mutant variants. Mr. Modi has said amid the second wave of coronavirus, mutant virus is posing a concern for the adult and children. He asked the state administration and district officials to prepare for this challenge by evaluating the data related to seriousness of this infectious disease. Stressing on the implementation of the COVID-appropriate behavior, the Prime Minister said, adoption of such behavior is the major tool in the fight against the COVID-19.
टेस्टिंग और डिस्टेंसिंग जैसे मेजर्स को लेकर लोगों में गंभीरता कम न हो, इसके लिए सरकारी तंत्र, सामाजिक संगठन, जनप्रतिनिधि, इन सबके बीच में एक सामूहिक जिम्मेवारी का भाव हमें पक्का करना होगा और प्रशासन की जिम्मेवारी और बढ़ जाती। कोविड एप्रोप्रिएट बिहेवियर जैसे मास्क पहनना, हाथ धुलना, जब इनमें कोई कमी नहीं आती, आपके जिलों में, आपके जिलों के बाजारों में, गांवों में कम से कम होने के बाद भी लोग सभी दिशा निर्देशों का पालन करते हैं, तो ये कोरोना से लड़ाई में बहुत मदद करता है।
Appreciating the role of the district officials in the fight against the COVID-19 pandemic, the Prime Minister said works done at the field level and the experiences and feedbacks shared by the district officials will help in making the practical and effective policies.
कोरोना के इस काल ने आपके काम को पहले से कहीं अधिक चैलेंजिंग और डिमांडिंग बना दिया। महामारी जैसी आपदा के सामने सबसे ज्यादा अहमियत हमारी संवेदनशीलता और हमारे हौसले की ही होती है। इसी भावना से आपको जन जन तक पहुंचकर जैसे काम कर रहे हैं उसको और अधिक ताकत से और अधिक बड़े पैमाने पर करते ही रहना। साथियों, नए नए चैलेंजेस के बीच हमें नए नए तौर तरीकों और समाधानों की जरूरत होती है और इसलिए ये जरूरी हो जाता है कि हम अपने स्थानीय अनुभवों को साझा करें और एक देश के रूप में मिलकर के हम सब काम करें।
Prime Minister Narendra Modi will interact with doctors, paramedical staff and other frontline health workers of Varanasi this morning through video conferencing. Prime Minister will review the working of various COVID hospitals in Varanasi, including Pandit Rajan Mishra COVID Hospital, which was recently commissioned through the joint efforts of DRDO and Indian Army. He will also review the working of non-COVID hospitals in the district. Mr. Modi will also discuss the ongoing efforts for tackling the second wave of COVID in Varanasi and preparations for the future. India achieved a new landmark in its vaccination drive as the cumulative number of COVID-19 vaccine doses administered in the country exceeded 19 crores today. Till now, over 19 crores 18 lakh people have been administered COVID-19 vaccine. On the 125th day of the vaccination drive yesterday, over 14,56,000 vaccine doses were given. Over 1.64 crore doses have been given to healthcare workers and over 2.30 crore doses administered to frontline workers till now.
The Union Health and Family Welfare Ministry has urged the states and union territories to make fungal infection, mucormycosis, known as the black fungus, a notifiable disease under the Epidemic Diseases Act 1897. The ministry has asked all the government and private health facilities, medical colleges to follow guidelines for screening, diagnosis, management of mucormycosis issued by the Union Health Ministry and the Indian Council of Medical Research. In a letter written to all the states and union territories, Joint Secretary in the Health and Family Welfare Ministry, Love Agarwal, has asked the health facilities to make it mandatory to report all suspected and confirmed cases to the Health Department. The Tamil Nadu government has declared mucormycosis as a notified disease yesterday. The State Health Secretary, Dr. Radhakrishnan, has said that hospitals should inform such cases to the government immediately. Meanwhile, the state continues to register of more than 30,000 COVID cases. More than 25,000 recoveries and 397 deaths were also reported in the last 24 hours. The Gujarat government has declared mucormycosis disease as an epidemic. This decision was taken in a core group meeting chaired by Chief Minister Vijay Rupani last evening. The mucormycosis disease, also known as black fungus, has been declared an epidemic under the Epidemic Disease Act 1857. More from our Ahmedabad correspondent.
Now government, private hospitals and medical colleges will have to follow the ICMR and Union Health Ministry's guidelines for screening, diagnosis and treatment of the disease. The details of suspected and confirmed cases of this disease will need to be sent to the central government. Gujarat has more than 1,000 confirmed cases of mucormycosis at present. Meanwhile, the daytime restrictions and night curfew in 36 cities of Gujarat have been extended till 27th May. However, commercial establishments including shops and street vendors are allowed to reopen from 9 a.m. to 3 p.m. All essential services in the state will continue as earlier without any restrictions. Yogesh Pandya, AIR News, Ahmedabad.
The government has asserted that the shortage of amphotericin B used for the treatment of mucormycosis will be resolved soon. Minister of State for Chemicals and Fertilizers, Mansukh Mandavia, said that within 3 days, 5 more pharma companies have got new drug approval for producing amphotericin B in India, in addition to the existing 6 pharma companies. He added that the existing pharma companies have already started ramping up the production. The minister informed that Indian companies have also placed orders for importing 6 lakh vials of amphotericin B. The Union Health Ministry has said that continuous improvement in the cases of recovery from COVID-19 is being noted in the country from the 3rd of May. The active cases of COVID-19 are also on a declining trend in this period. Addressing the media, Joint Secretary in the Health Ministry, Love Agarwal, said that the number of active cases has now come down to 12.1% from the level of 17.13%, while the recovery rate has improved to 86.7% from the level of 81.7% on the 3rd of May.
पिछले 10 दिनों में अगर हम डेटा का आकलन करें तो पाते हैं कि रिकवर्ड केसेस आर मोर देन द एक्टिव केसेस, जो कि एक बहुत पॉजिटिव ट्रेंड है। आज भी हम देखें तो पाते हैं कि हमारे एक्टिव केसेस 69% के करीब एक्टिव केसेस अभी केवल 8 स्टेट्स में लिमिटेड हैं और 21 स्टेट्स देश में ऐसी हैं जहां पर की रिकवरी डेली रिपोर्ट होने वाले केसेस से अधिक है। 13 स्टेट्स ऐसी हैं जिन्होंने पिछले 24 घंटे में 10,000 से ज्यादा रिकवरी भी नोट की गई हैं।
The Government of India has been receiving international cooperation of COVID-19 relief medical supplies and equipment since the 27th of last month from different countries and organizations. These have been promptly dispatched and delivered to states and UTs. More than 13,000 oxygen concentrators, 15,000 oxygen cylinders, 19 oxygen generation plants, 10,000 ventilators or BPAP, and over 6 lakh remdesivir vials have been delivered or dispatched through road and air till now. National Commission for Protection of Child Rights, NCPCR, has stressed that centre and states should ramp up their preparations to protect children and neonatals as the third wave of COVID-19 is projected to hit the country. In a letter to Union Health Secretary Rajesh Bhushan, NCPCR Chief Priyank Kanungo has emphasized the importance to reorganize the National Emergency Transport Service and requested to issue necessary directions for the service and ambulances to prepare specifically for neonatals and children. Mr. Kanungo asked the Health Ministry to apprise the Commission if additional protocols or guidelines have been developed by the ICMR for prevention and clinical management of children. In his letter to Health Secretaries of States and UTs, the Apex Child Rights Body Chief said, keeping in view the higher risk involved for infants and children in the third wave, the NCPCR has developed a format to collect information of functioning of neonatal intensive care units, pediatric intensive care units and special newborn care units.
Tamil Nadu continues to register more than 30,000 COVID cases. More than 25,000 recoveries and 397 deaths were also reported in the last 24 hours. In Chhattisgarh now, it will not be mandatory for air passengers coming from other states to show negative report of RT-PCR test at the time of boarding. The state government has made partial amendments in the guidelines issued earlier regarding the mandatory COVID test report. We have more from our Raipur correspondent.
In Chhattisgarh, new guidelines have come into effect from today for passengers coming from other states. According to these guidelines, passengers coming to Chhattisgarh by rail, road or air should have a negative report of RT-PCR test done within 96 hours before the start of the journey or a certificate of both doses of the COVID vaccination. Those air passengers who do not have the RT-PCR test report for the specified time period, their COVID test will be done at the airport and these passengers will have to remain in home isolation till the report is received. The same guidelines will also be applicable to passengers arriving by rail or road route. Vikalp Shukla, AIR News, Raipur.
Odisha government has decided to include mucormycosis as a notifiable disease under the Epidemic Diseases Act 1897. The decision has been taken in view of the reported rise in incidence of black fungus among COVID-19 patients currently under certain drugs and also among patients in the post-COVID period. We have more from our Bhubaneswar correspondent.
Earlier, the state government had already formed a state-level task force to formulate guidelines for early detection and management of such cases. The committee had recommended to include black fungus as a notifiable disease so that the report on all such suspected and confirmed cases can be shared for early treatment and monitoring. It has also been clarified that mucormycosis has not yet been declared as an epidemic in the state. Meanwhile, the daily new cases of COVID-19 infection continue to hover around 10,000, leading to a total active case load of about 1,06,000 as of now. There is Chandra Das, AIR News, Bhubaneswar.
We now have a positive story. Gaurav Rai, now known as Bihar's Oxygen Man, has saved over 1,500 lives across the state by providing oxygen cylinders free of cost to critically ill patients in home isolation. After recovery from COVID-19 last year, Mr. Rai started Oxygen Bank at his Patna home. His effort has proved to be a lifesaver for many patients, particularly at a time when the second wave of the virus has battered Bihar. More from our Patna correspondent.
People hardly know him by his real name Gaurav Rai in Bihar, but if one mentions of Oxygen Man, and he is instantly recognized as the lifesaver of critically ill COVID patients in times of severe oxygen shortage. At a time when hospitals were turning away COVID patients due to shortage of beds and oxygen cylinders, Gaurav Rai has come across as an angel for the distress, attest several patients who have got a new lease of life due to his efforts. He started the initiative in July 2020 with just 3 oxygen cylinders and now has 122 cylinders. Mr. Rai, who is a general manager in a private company, spends rupees 20,000 per month from his salary and also a share of his wife's earnings for the purpose.
ऑक्सीजन बैंक के द्वारा हम लोगों की निःशुल्क सेवा कर रहे थे, कोई पैसा नहीं लेके। लोगों से एक निवेदन है कि कृपया ऑक्सीजन सिलेंडर ले जाते वक्त पूरी अच्छी तरह जानकारी ले लें और उसको अपना चीज समझ के उसको यूज करें। जो भी पेशेंट ऑक्सीजन सिलेंडर को यूज करते हैं, जब वो अच्छे हो जाते हैं तो उनके घर परिवार वालों के साथ मैं एक केक लेके जाता हूं और उनकी खुशी में शरीक होता हूं। ये खुशी इसलिए होती है कि हम लोगों का एक छोटा सा प्रयास जो था वो सफल हुआ।
The day starts at 5 a.m. for the Oxygen Man, who transports the cylinders in his own car to serious COVID patients. The Oxygen Bank extends services in different districts, including Patna, Buxar, Bhagalpur, Siwan, Gopalganj and Gaya. With KK Lal's report, Ravi Kumar for AIR News, Delhi.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi says government is continuously engaged in maintaining the supply of COVID vaccine. Highlights the need to avoid wastage of vaccine by states. Prime Minister to interact with doctors, paramedical staff and other frontline health workers of Varanasi this morning. India achieves new landmark as cumulative COVID-19 vaccine doses administered cross 19 crores. National COVID recovery rate improves to 86.74%. Due date of furnishing of income tax returns for the assessment year 2021-22 for individuals extended by 2 months from 31st July to 30th September. First session of the 15th Assam Assembly begins today. U.S. President Joe Biden signed anti-hate crime legislation to address rise in violent attacks against Asian Americans and Pacific Islanders. Ceasefire comes into force in Gaza Strip, bringing a halt to fiercest fighting between Israel and Hamas. And in cricket, former Indian skipper Rahul Dravid to coach Indian limited overs team that will play against Sri Lanka in July. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे।
Welcome back. You are listening to the morning news. In Karnataka, the hospital bed booking system software for the COVID patients has been upgraded to publish a dashboard containing real-time information on bed availability in Bengaluru. The Member of Parliament from Bengaluru South, Tejaswi Surya, has informed that the public can now find zone-wise booking and admission and discharge data of patients in government and private hospitals. More from a Bengaluru correspondent.
The availability of hospital beds, especially those with ICU and ventilator facilities, have become difficult to get in Bengaluru. Due to loopholes in the bed booking software, real-time information on the availability of beds were not available to the people. Hence, these loopholes are plugged now to provide transparent real-time data, reducing misuse by human intervention. In this public dashboard of Bruhat Bengaluru Mahanagara Palike, a patient now gets an instant SMS alert after a bed booking, and two-factor authenticated person-specific login has also been introduced into the system. Several more reforms like a digital queuing system for allocation of beds are in the pipeline and will be introduced in a week's time. Sudhindra, AIR News, Bengaluru.
In the Kashmir Valley, Kupwara police have arrested 2 terrorist associates and recovered 6 live grenades from their possession. They have been identified as Jahangir Ahmed and Abdul Hamid, both residents of Khawarpara, Tangdhar. During searches, incriminating materials, including 6 live grenades, were recovered from their possession.
The government has extended the due date of furnishing of income tax returns for the assessment year 2021-22 for individuals by 2 months, from 31st July to 30th September 2021. Finance Ministry said that the decision to extend timelines for compliances under the Income Tax Act was taken in light of COVID-19 pandemic. The government has also extended the due date of income tax returns filing for companies for assessment year 2021-2022 from 31st October to 30th November. In addition to it, the due date of furnishing of belated or revised return of income tax for the assessment year 2021-22, which is 31st December, has been extended to 31st January 2022. The ministry said that the deadline for issuing Form 16 by employers to employees has also been extended by a month till 15th of July this year. The due date of furnishing of report of audit for the previous year 2020-2021 was extended to 31st October this year from 30th September.
Newly established University of Ladakh is steadily progressing in academics and in creating infrastructure. With 17 academic courses in Leh and Kargil campuses, the university chalked out the plan for the next 10 years. More from a Leh correspondent.
Fulfilling the dreams of Ladakh youths for higher education at their home, University of Ladakh made a steady progress. With the transfer of Leh and Kargil campuses of Kashmir University, the University of Ladakh got a head start to offer 17 academic courses to 250 students. University authorities have discussed a perspective plan for infrastructure development for next 10 years with the CPWD and UT Public Works Department. After inaugurating zoology and geology labs and library at Taru campus in Leh, University of Ladakh Vice Chancellor C. Punchok said,
17 कोर्सेज पिछले 2 साल में हमने इंट्रोड्यूस किया है. इवेंचुअली 65 तक का कोर्सेज हम यहाँ स्टार्ट करेंगे. उसके अलावा फिर रिसर्च प्रोग्राम जो आर्ट्स में हो या साइंस में हो, हमारी कोशिश होगी इंफ्रास्ट्रक्चर फैसिलिटीज अच्छे हो, एकेडमिक्स अच्छे हो, टीचर्स अच्छे मिल जाए. ये सारे मेरे ख्याल में अगले 2-3 साल में उम्मीद है कि ये सारे नॉर्मलाइज हो जाएं.
University authorities are making efforts to create better infrastructure for strong academics in 6 affiliated colleges in next 2 years to hold Ladakhi students back and attract them to University of Ladakh college campuses. Apart from this, authorities working on to complete the examination formalities of all batches that began with Kashmir University before creation of University of Ladakh. Ramesh Chandra, All India Radio News, Leh.
United States President Joe Biden has signed an anti-hate crime legislation yesterday, directing federal law enforcement to address a rise in violent attacks against Asian Americans and Pacific Islanders during the coronavirus pandemic in the USA. President Biden said that there are simple core values and beliefs that should bring all together as Americans. One of them is standing together against hate, against racism. He was speaking at a White House ceremony attended by Democratic legislators and administration officials.
There are simple core values and beliefs that should bring us together as Americans. One of them is standing together against hate, against racism, the ugly poison that has long haunted and plagued our nation. Today, I can say that you've taken that first step. We heard how too many Asian Americans have been waking up each morning this past year genuinely fearing for their safety. But of all the good the law can do, we have to change the hearts of the American people.
A ceasefire came into force in Gaza Strip, bringing halt to fiercest fighting between Israel and Hamas. The Egypt-brokered ceasefire began early this morning, ending the 11-day fighting. The Security Cabinet of Israel had approved a ceasefire in the Gaza Strip, bringing a potentially tenuous halt to the most aggressive fight in decades. The Cabinet said it had voted unanimously in favor of a mutual and unconditional truce proposed by mediator Egypt. The development came a day after U.S. President Joe Biden urged Israeli Prime Minister Benjamin Netanyahu to seek de-escalation and amid mediation bids by Egypt, Qatar and the United Nations. A Hamas official told media that the ceasefire would be mutual and simultaneous. Palestinians poured onto the streets of Gaza soon after the truce began. And now, news from the world of sports.
Former India skipper Rahul Dravid will coach the Indian limited overs team that will play a 6-game series against Sri Lanka in July. The 3 one-day internationals will be played on 13th of July, 16th and 19th, and the T20Is are expected to be played from July 22nd to 27th. BCCI has requested the England and Wales Cricket Board to advance the start of the 5-match test series between England and India by a week so that a window could be created in September to finish the postponed Indian Premier League season. The test series against the host will commence in Trent Bridge on August 4th and conclude at Old Trafford on 14th of September. BCCI Secretary Jay Shah has announced that Indian women's cricket team will play its maiden day-night test during the tour of Australia later this year. The Indian women's team will be playing its first test in 7 years from June 16th in England. From other sports news, flying Sikh Milkha Singh has been tested positive for COVID-19 yesterday. The 91-year-old athlete is slated to be stable and in home isolation at his residence in Chandigarh. Sports Authority of India has decided to extend medical and accident insurance cover to more than 13,000 athletes, coaches and support staff. As per the plan, an insurance cover of 5 lakh rupees each will be provided to all the national campus. Khelo India and junior athletes training at SAI Centre of Excellence will also come under the scheme. Sports Minister Kiran Rijiju said all national level athletes will have insurance cover not just during the camps but throughout the year under the scheme. Mission Olympic Cell of Sports Authority of India approved a grant of 20.21 lakh rupees for Olympic-bound women wrestler Vinesh Fogart to train in Europe. Vinesh secured Olympic berth in women's 53 kg freestyle event during the 2019 World Wrestling Championships.
Now let us take a look at the weather forecast for today. Jammu will have mainly clear sky becoming partly cloudy towards afternoon or evening. Srinagar will have partly cloudy sky with possibility of rain or thunderstorm or dust storm. Leh may see generally cloudy skies with temperature moving from 4 to 19 degrees Celsius. Gilgit will also have generally cloudy sky with possibility of rain or thunderstorm or dust storm. The temperature will rise up to 27 degrees Celsius with a minimum of 15 degrees. Muzaffarabad is expected to have partly cloudy sky with possibility of rain or thunderstorm or dust storm. The maximum temperature is expected to be around 33 degrees Celsius. It recorded a minimum of 18 degrees. Dehradun will have generally cloudy sky with 1 or 2 spells of rain or thunderstorm. The maximum temperature will be around 30 degrees Celsius, while the minimum was 18 degrees.
And now an overview of today's newspapers. India to scale up daily testing to 45 lakh per day by June end, reports Financial Express. India faces black fungus epidemic as cases climb, leads Hindustan Times. The paper quotes Prime Minister Modi as saying, virus a shapeshifter, don't lower guard. Workout strategy to save rural India from COVID, Prime Minister tells district magistrates, informs the Pioneer. Aerosols can travel up to 10 meters. Ventilation is the key, says the government, writes the Hindu. Congress leader Sonia Gandhi writes to Prime Minister, seeks free education for orphaned kids, informs the Statesman. Sports Authority of India to provide health accident insurance to athletes, staff, reports the Hindu. And finally, individuals can file tax returns till September 30. Well, the Times of India report that CBDT has also extended the income tax filing deadline for companies by a month to November 30.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi says government is continuously engaged in maintaining the supply of COVID vaccine, highlights the need to avoid wastage of vaccine by states. Prime Minister to interact with doctors, paramedical staff and other frontline health workers of Varanasi this morning. India achieves new landmark as cumulative COVID-19 vaccine doses administered cross 19 crores. National COVID recovery rate improves to 86.74%. Due date of furnishing of income tax return for the assessment year 2021-22 for individuals extended by 2 months from 31st July to 30th September. First session of the 15th Assam Assembly begins today. US President Joe Biden signs anti-hate crime legislation to address rise in violent attacks against Asian Americans and Pacific Islanders. Ceasefire comes into force in Gaza Strip, bringing a halt to the fiercest fighting between Israel and Hamas. And in cricket, former Indian skipper Rahul Dravid to coach Indian limited overs team that will play against Sri Lanka in July. And for details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the morning news. Have a nice day.